All right, so what do we do if we break a file? This could be a hand file, it could be a rotary file, it could be anything. And unfortunate as it is to say, if you do enough root canals, file separation is just something you're going to encounter. No amount of you can do all the preparation, you can do all the, everything you can to avoid it, but at some point, if you are doing a bunch of root canals, it's going to happen. It just kind of comes with the territory. The good news is there's a lot of, it's not very often actually that file separation or a segment of a separated instrument actually leads to failure. That's actually pretty seldom. The challenges that it can present, though, are kind of, they're more frustrating than anything. So let's start from the beginning. We separate a file by the two methods. One is cyclic fatigue, and the other is torsional strain. We talk about these two things in the part where we talk about our rotary settings. Regardless of how the file separates, say your file separates. The first thing you want to do when a file separates is to pull out the segment that didn't separate, the part that's either still in the rotary handpiece or in your hand. You want to take it out and you want to measure how long the piece is that's separated in the tooth. This could be anywhere from just the tip, like 0.5 millimeter of a file, all the way to like a 15 millimeter segment of a file. But that's the first thing you want to do, is you want to know how much of the file separated, so you kind of know what you're up against. The second thing you want to do is you want to see if you can see where inside of the tooth the piece of instrument separated off. If you separated a really long piece of an instrument, you might even see it, sticking out of the orifice. And honestly, that would be great. That would be one of the easiest types of separations to manage versus the other one where it's a really tiny piece that you can't see. But that's the second thing you do, is you want to determine those things. Now, once you have these two pieces of information, you can kind of make your game plan from there. I guess then the question becomes, do we keep the file in there that's separated? Do we take it out? Do we bypass it? Do we maybe refer out? How do we determine this? So the first thing you should check is, this is where diagnosis comes into play. You want to see what your diagnosis was. If your diagnosis was, say, a vital tooth, right? Like vital means reversible pulpitis, asymptomatic irreversible, or symptomatic irreversible pulpitis, or even like normal pulp, and you're doing this for restorative reasons. If your pulp is vital from the start, it means that bacteria hasn't infiltrated the nerve system all the way down through the apex into the bone just yet. Which means that, because bacteria actually approaches a tooth from crown down also, just like we do, which means that at some point in the canal system, the bacteria is kind of suspended. It's really through the whole thing, but the bulk of it hasn't made it all the way through yet. This means that the prognosis for leaving a short fill is actually much higher in a vital tooth than a non-vital tooth. If your diagnosis pre-op was that the tooth is non-vital, that means the bacteria has gone all the way through the tooth and is already kind of in the bone outside of the tooth. Now, so that's the pulp vitality diagnosis. Now you look at your periapical diagnosis. If there's no lesion, that means that there has been no kind of like immune cascade yet at the apex of the root, or there's no abscess at the apex of the root, which means that there's nothing actually going on beyond, not nothing, but minimal kind of going on kind of beyond the apex of the tooth. Okay, why are these things important? Why did I just go on about diagnosis when we're talking about file separation? So the diagnosis actually is the big determining factor that lets you know whether or not you should be focusing on removing the file or not. If we say that the tooth is not that kind of bacteria laden, so that means like if it's still vital, you can in theory say I separated a Vortex Blue 2004 all the way at the tip of the root, right? Like the Vortex Blue 2004 has made it all the way to the end of the root. That actually tells me that I have cleaned out all the way to the tip of the root, and the tooth probably didn't have that much bacteria to begin with. And I take it my file was, of course, my file was sterile before I put it in. So in that case, you're putting a sterile instrument all the way at an apex that maybe doesn't have that much bacterial infiltration yet. In a case like that, leaving that piece of the file in there might not be the worst thing. You know, it essentially, you've cleaned out the root already and it will just become a part of the obturation material. What if I had an acute apical abscess? You know, we'll go to the most dramatic end of it, and you have this acute abscess at the end of the root, and I separated my Vortex Blue 2004 at the tip of the root, right? Because we know bacteria is probably already infiltrated to kind of like beyond the apex, and the apical delta is filled with bacteria because, you know, there's an abscess here. And we know that our Vortex Blue 2004, yes, it cleaned some, but it likely didn't clean into the apical delta at all. A case like that, we would say, look, like we did not get enough cleaning done. We gotta try to get this instrument out, or we gotta try to bypass this instrument. So that's a case in which you would have to try to remove the instrument. So what am I getting at here? I am getting at the fact that what determines whether or not you should be bypassing or removing your separated instruments comes down to how much bacteria is likely at the apex of the root, or down the length of the root, or in the apical delta, or somewhere thereabouts, right? So that's really, experience would guide you and tell you really what you should do. You know, a bunch of guidelines in Pathways of the Pulp will tell you probably what's the best time to, which is the best way to go there. But essentially that's where we should be thinking. What is the bacteria kind of doing, right? So that's how we determine whether or not we should even be removing or bypassing. Now, the other question of separated instrument is where exactly in the tooth did the instrument separate, right? Like if it's separated, so I give the example of the instrument separating all the way at the apex. That's more or less going to determine, like, you know, you should remove that or bypass that if, you know, if is determined by the bacterial load that you think there is, which is determined by the diagnosis, the pre-op diagnosis. Now, what if I separated an instrument in the middle third or the coronal third? That gets into kind of sticky territory because we know that it depends where in the procedure you separated that instrument. If you're already done cleaning the apex, and I've already put my finishing file in there, the finishing file is 3506, and I've cleaned it all the way to the apex, and I pull it out, and I think to myself, like I'm gonna put it in one more time just because like I want to clean it one more time, and I kind of wedge it into the curve that's mid-root, and the file separates in that curve. Do we have to remove that separated instrument? Ideally you would, because it would help your obturation out, of course, but in terms of a bacterial standpoint, you've already cleaned out the apex of the root, like leaving, you know, an instrument there wedged halfway in, you know, it would become a part of the operation, wouldn't be the worst thing in the world. Is it worth potentially perforating the tooth just to remove the separated instrument? That might not make a difference with long-term treatment. Maybe not. But what if we're early on in the treatment and it's only been my size 1504 that I separate halfway down the root? Well, in that case, you haven't cleaned anything at the apex, and you got to try to get that thing out. Then it becomes worth it to kind of get in through there. So again, there is this kind of big conversation of how much bacteria is there, and then the risk-benefit analysis of you know, what other damage you might do to the tooth in removing that file.